Greetings from Lanka Hospital. My name is Dr. Devanand Jha. I'm a resident consultant working in Lanka Hospital for a little over 20 years now. It's a pleasure to interact with all of you. It's a pleasure to talk to you and discuss with you some of these burning questions regarding hearing problems in the general population. Hearing problems can be divided into problems right at the birth of a child or going right up to a very old man who struggles to hear people properly. Let's get on with the discussion with the problems in young children. Now, the most important thing that I wanted to talk about was children who are born deaf. It's very important to find out that a child who has been born, is he hearing or not? So at Lanka Hospital, we have a universal hearing screening where we screen all children who are born at Lanka Hospital whether they can hear or not. So the audiologist will tell you whether the child has passed the hearing test or referred. So if it's a refer, then we go ahead and do a more advanced test for the child, which is called a auditory brainstem response test, which is a more advanced test where we can find out exactly what is the level of the child's hearing. Now, it is of paramount importance to determine right at the beginning or when the child is very small whether the child is hearing or not. If the child is not hearing or the hearing is less, then we fit the child with hearing aids and encourage the parents to do a surgery called cochlear implant at the age of 1 year, which is the best time to operate. When if the child has got the implant, then most likely the child will speak normally, the child will hear normally, and the child will be like any other children who are born with normal hearing. So it's very important to identify hearing loss as soon as possible. So we try and fit the hearing aids even before we give the implants to the child. And you will be happy to know Lanka Hospital has been a pioneer in cochlear implants. I started cochlear implants in Sri Lanka way back in 2006. We have done, I would say, around 150 implants at Lanka Hospital, and all our children and some adults that we have implanted, they're all doing quite well. The other reason for hearing loss can be because of medical issues. For example, children may have fluid behind the eardrum, and the teacher would perceive that the child is not hearing very well, so they would feel the child is not concentrating or the child is not interested. The fact of the matter would be the child has a hearing problem, and hence the child is not concentrating in the class. So we do determine that there might be fluid behind the eardrum, especially if a child has given a history of a cold. In most instances, they are amenable to medical treatment where we give medications, we give nasal drops, we give syrups, we give tablets if necessary, and the children generally recover. Sometimes they don't, then we have to do minor procedure called grommets. Now, where we put minor tubes, small tubes in the ear to drain the fluid, and that usually falls off in 3 to 6 months' time, and the child gets his hearing immediately after you have put the grommets. So once you don't drain the fluid, the eardrum gets pulled back, and then a more serious disease starts, which is called a retraction pocket cholesteatoma or a bone destroying disease. Cholesteatoma has nearly been wiped out or is rather rare in the Western countries. It's more important to realize that in those countries, since the patients at large or the parents at large are more aware of this situation, that they do the grommets. So millions of grommets are done abroad, but unfortunately in our part of the world, parents are very scared for operation, they don't do it, so cholesteatoma is still very common. Now, as the child grows older or little older age group or in the adult age group, you can have the people may have pus discharge coming from the ear and hearing problems. So one thing to realize is that if you have a pus discharge, just putting antibiotic and a ear drop is never the answer. You have to go to an ENT surgeon and get a diagnosis made. So the ENT surgeon will diagnose the problem for you and tell you whether the disease is limited to the eardrum, which we call in our parlance a safe otitis media or safe chronic suppurative otitis media, or it is a bone destroying disease where the disease has a tendency to go towards the brain. So sometimes you can have problems in the brain stemming from problems in the ear or starting from problems in the ear. So it's very important to get a diagnosis done first. Things may not be so simple. There are many gray areas where it may not be a completely safe CSOM, or it may be gray areas which may need addressing also. Sometimes the hearing bones get destroyed, and then they would need we would need to do a tympanoplasty or reconstruct the hearing mechanism for a person to hear better. A thing that I wanted to talk about, and something which Lanka Hospital takes pride in, is that we at Lanka Hospital have also been the pioneers of stapes surgery or stapedectomy, something we have been doing since 2002. It is being done elsewhere in the other hospitals as well, but we have the largest number of cases and we have the best results for stapedectomy patients. What happens in this is that the patient experiences a hearing loss starting maybe from early adulthood and progressive in nature. When we question them, they may also give a history that maybe their grandparents or their aunties or uncles or someone in the family may also be having this problem. It is hereditary in nature, but not everyone will have it. And then when we do a hearing test, we find out that they have a conductive hearing loss, meaning thereby that the sound which is being conducted through the hearing bones, it is not being conducted very well. There is a block at one place, and which is usually the third hearing bone, that is called the stapes bone. So the first hearing bone is moving, the second hearing bone is moving, but the sound is not transmitting well or not conducting well through the third hearing bone. So that may require removal and replacement by a piston. The piston connects the second hearing bone with the inner ear. That we call in our parlance stapedectomy. It is a very fine surgery. We have also acquired laser recently in our hospital. We use laser also, which also improves our visualization, which improves our technique as well. And we have very good results with stapedectomy. And most of our patients who haven't heard sounds heard very clearly for many years are very grateful to us. So we have operated several doctors also, and they are also very happy with the outcome. And of course, as a person ages, then we may find that the hearing nerves have become weak. When the hearing nerves become weak, then elderly gentleman may need hearing aids to help to support his hearing. Now, what is very common in our society is that when you tell elderly gentlemen that you need hearing aids to hear better because your hearing nerves are weak, the first reaction is, I don't have many years to live, I may die soon, so what is the use of putting a machine now? The fact of the matter is, if you do not hear well, then you withdraw from the society. You will not hear conversations, you will not hear your family members, you will not hear your near and dear ones, and that would cause a psychological impression on you. You will have a depression. So it's better to wear a hearing aid. So not only would that sustain the level of hearing the elderly gentleman has or the elderly lady has, it would also make them hear better, such that they feel more part of the society. Something also I wanted to talk about is that many of these elderly patients lose their hearing completely. We can still do cochlear implants in that age group. This is what I wanted to emphasize about, because in many instances a lot of people are aware that there is a technology called cochlear implants, and if a child is born deaf and dumb, if you do the implant at the right age, the child will hear. But what about the adults? There is a section of adults whom the most powerful hearing aid is not benefiting, and then we just can't consign them to a life of deafness. So cochlear implants can be done at any age, and in that age group, when the adult has learned to speak, and they hear, but over a period of time they have lost their hearing, we can still do an implant in those adults. I still remember I went to a conference in US when one of the participants there said that the surgeon had implanted a 94-year-old. I mean, that really seemed very baffling to me at that time. But I realized that even the 70s or the 60s or the 75-year-olds in our part of the world, they just give up. That okay, I've had a good life, so I think I'll be confined to a life where I'll remain deaf, which is possibly not acceptable in today's world. In today's world, everyone has a right to hear, so why not? So you should get the cochlear implant if the most powerful hearing aids are not working. It is also to be remembered that there are a subgroup of patients who are born deaf but who come to us when they are in their 16s, 17s, 20, 25. Unfortunately, there is something called neural plasticity, where in the initial ages, the brain is like a blank software. So it can acquire all the information initially. And there's a certain golden period up to the age of 2.5, 3 years, where the neural plasticity really works well, and then there is a rapid decline. So after the age of say 6, 7, 8 or 9, the chance that the child will speak if he has not heard before is very less. So again, I'll emphasize to everyone that if you have seen a child who is born deaf or who is not hearing and who is still below 5 years of age, it's a golden opportunity to get the implant done, and most likely the child will hear. Also, I wanted to emphasize that the very old patients also who can still undergo an operation, who are profoundly deaf, are also candidates for cochlear implants. Or there can be people who, even in the middle age group, who lose their hearing completely, where hearing devices do not help, are also very good candidates for cochlear implants. If you have learned language and speech and you have lost your hearing completely, we can still do a cochlear implant and get your hearing back. That is number one. Number two, the ear problems or the hearing problems should always be taken seriously. I also want to talk about a certain condition, and that is called a sudden sensory neural hearing loss. Now what happens is, the patient perceives a sudden block in the ear, and in most instances they feel there's possibly a bit of a wax or something that has stuck in the ear, and that's why they have lost their hearing. So they ignore it initially, and when that block persists for a few days, then they go and see the ENT surgeon. Unfortunately, it can be too late. The ENT surgeon looks in the ear, he finds nothing wrong. He gets a hearing test done and he finds that the patient has lost his hearing on a particular side, and the hearing may have gone down to a variable degree. Now, the patient is quite shocked. He says, I've never had a problem. I didn't have fever, I didn't have any problem. How did I get a virus infection into my inner ear for which I have lost my hearing? So, hence, a take-home message is, if you have a block in the ear or a hearing problem, please see your ENT surgeon as soon as possible, because there is a golden period for that, wherein we can give injections through the eardrum, wherein we can give you tablets, and there's a good chance that we can get your hearing back to a variable degree, and sometimes if you're very lucky, we can get your hearing back altogether. So the essence of my talk to you today was, please do not ignore any hearing problem. In most instances, everything is treatable. Do consult your ENT surgeon, and hence do avail our facilities and do not suffer in a world where you don't hear. Thank you so much.